12 News reporter Anita Buffoni has the latest on the state's work to get the virus under control. Anita?
Well, Mike and Shannon, even with the alarming numbers the state is experiencing, there was some good news that came out of today's press conference. 29,000 doses of a vaccine are on the horizon for Rhode Island, and asymptomatic tests have been boosted at testing sites, including here at the Dunk and the Convention Center.
No good news in this data. Nothing good to share.
Governor Gina Raimondo starting off the weekly briefing with the state's grim numbers, the daily positivity rate at 8%. But then turning to news many have been waiting for. Once the FDA approves the Pfizer and Moderna vaccines, this month the state is anticipating to get its first round of doses.
So by the end of the year, I think we'll have about 29,000 doses of vaccine in Rhode Island.
900 extra hospital beds have been opened up now that the state's 2 field hospitals started accepting patients this week. The governor is putting a call out to anyone with health care experience to help out. The state will again start issuing certain temporary medical licenses. Now, in regards to testing, the governor says asymptomatic testing will get a boost. The Dunkin' Donuts Center will administer 2,500 tests daily by next week, and other testing sites will also get a bump.
And by the way, we're going to keep adding supply to the system to really keep it moving.
Even though early data suggests Rhode Islanders are following the guidance, according to Raimondo, she didn't rule out the possibility the 2-week pause may get extended.
For those of you who doubt that we have a crisis, I hope this data is jarring for you and motivates you to take action.
Now at 6, Governor Gina Raimondo says there's no good news about Rhode Island's current coronavirus numbers. Good evening, I'm Shannon Heggie.
I'm Mike Montecalvo. The governor says people should not panic, but take action, saying the state can turn this trend around. Now, that trend has pushed the total number of cases past 60,000 and the death toll to 1,400, with more than 400 people in the hospital.
Today we learned the first vaccines are expected to arrive in Rhode Island in a matter of weeks. 12 News reporter Anita Buffoni begins our team coverage.
Shannon and Mike, there is some good news coming out of the briefing today. The governor said that 29,000 doses of a vaccine may be coming to the state by the end of the year. With the race to get a vaccine approved by the FDA, Rhode Island is preparing for when it will arrive.
I think we could receive about 10,000 doses of the Pfizer vaccine in the next few weeks. I think we'll get about 19,000 doses of the Moderna vaccine probably a week after that.
But it doesn't mean things will get immediately better. Governor Gina Raimondo says more doses of the vaccine will trickle into Rhode Island over a number of months. First responders, healthcare workers, and those who are high risk will get the vaccine first. This comes at a time when the state is seeing record high cases and hospitalizations.
For those of you who doubt that we have a crisis, I hope this data is jarring for you and motivates you to take action.
Now that the state's 2 field hospitals are taking patients, that opens up about 900 extra beds. Raimondo putting a call out to anyone with healthcare experience to lend a helping hand.
I know some of you are saying, well, Gov, there's 900 beds and they're not filled. This is true. But what good is a bed if you don't have adequate staffing?
As Rhode Island pushes through the first of the 2-week pause, there's some good news. Raimondo says early data suggests Rhode Islanders are complying to the health and safety guidance. However, she didn't rule out the possibility that the pause may continue past December 13th. Now, we've also learned today there's a boost to asymptomatic testing. For example, here at the Dunkin' Donuts Center, they currently test about 500 people per day, but that will get boosted to 2,500 by next week. Live in Providence, I'm Anita Buffoni, 12 News.